Good morning everyone. Today I'm going to show you how to use the Careflow system in the ED department of Lincoln County Hospital. So first of all, you would find out the Careflow or Midway icon on the desktop and press it. After entering your login details, this would be the first screen to show up for you. You would find on the left side that you can choose current patient in A&E department or another option called view department. After pressing the view department button, you would also need to choose which hospital you would like to have access to, either Grantham, Lincoln or Pilgrim, and you would also get to choose between two styles of viewing, either a coordinative view or a segmental view according to the places of the patient, either minors, majors, waiting area, recess, etc. You can choose that from the tab pointed with the red arrow on the left hand picture. Again, you can select or search a patient directly if you got his details like surname or NHS number from the tab pointed by the green arrow on the right hand side picture, so that it can just make things easier for you. After pointing out which patient you would like to go and see, you would right click on his name and you will choose See Patient option. After pressing See Patient option, a small dialog box will pop out for you like the one shown in the picture. Make sure to enter your name, time and date, and the most important thing is to tick the box of responsible clinician, and after that press add scene activity. You will automatically find your name popping down in the gray box shown in the picture, and this means you would be appointed to see this patient. One small tip to keep an eye on: whenever you have a handover from a team member, you would need to switch the patient on under your name. So when you do the same steps again, make sure to tick the responsible clinician, or your name will not be changed to that patient. After you have seen the patient, you would need to record his clinical details on the system. To do that, you would again go on the patient name, right click the name and choose the Record Clinical Details option to start coding your patient. After that, a small dialog box will pop out as the one seen on the right hand picture. After that, you would select from the different tabs on the left any of the treatments and investigation that you have done for that patient, and also you would select a diagnosis that you are suspecting or you have made regarding your patient. A final step in the coding of the patient is the discharge summary letter. Again, after choosing a diagnosis, you would need to right click on the clinical text box. It will pop out a dialog box like the one shown on the right side, where you would need to write few lines summarizing what has happened for the patient today in his visit. so that his or her GP can have access to these records and have a track of what have happened for the patient. In case your patient need to be admitted under another team for continuity of care, then a DTA need to be done. Before doing a decision to admit for your patient on the system, you need to discuss the case with a more senior doctor or with the consultant present on the shop floor. If he agreed on the DTA decision, then you would go on the system, right-click the name of the patient, choose Record DTA, then a small dialog box like the one shown on the right-hand side will pop out for you. You will fill in the details and select the relevant team such as medical, surgical, orthopedic, etc. and you would lock the patient with the DTA decision. Finally, if your patient doesn't need admission and you're going to discharge the patient, after filling out all the details as we discussed earlier in recording the clinical details, you would need now to discharge him off the system. So you would go on his name, right click his name, then select discharge. A small dialog box will show up as the one presented on the right side. Then you would start filling all the relevant information and click save, so that the patient would be discharged from the list of the patients. A small tip to have an idea about is how to search a recently discharged patient. So for example, if you discharged a patient and you forgot about something in the coding and you would like to add it up, you go to the main menu. Instead of pressing View Department, you would select this time View Recent Discharged Patient as pointed with the red arrow. After that, from the toolbar that pointed with the green arrow, you will choose which site, either again Lincoln Hospital, Grantham or Pilgrim, and after that you would have a list of the patient who have been recently discharged. You can either search with the surname, NHS number or date of birth.